Most doctors were never taught the business side of medicine. Dr. Heather Signorelli is on a mission to fix that, transforming struggling practices into thriving ones with evidence-based and physician-led billing solutions. Next on DocStars.
Welcome to DocPod's DocStars.
Hello, everyone. I'm JJ, and thank you for joining us on DocStars on the DocPod channel. Today, we're talking with Dr. Heather Signorelli, physician, entrepreneur, and co-founder of NatRevMD. She reveals how doctors can build thriving business practices, master insurance billing, and boost revenue by 25 to 30% without burnouts. From work-life balance to cutting-edge revenue cycle management, this episode is your blueprint for physician success. Dr. Heather Signorelli, welcome to DocStars.
Oh, thank you. Thank you for having me so much. I appreciate it. Excited to be here.
Yeah, this is great because I think, and you and I talked about this before the show, there are a lot of things for this particular episode that are going to pertain to physicians. But again, for me as a patient, I always want to advocate for myself. So I think understanding what that looks like from the patient side is also very important. So let's kick it off. Let's start a little bit with what I like to call the journey and the mission, right? Physician entrepreneur, physician business owner, building a medical practice. You built a career as both a physician and a business owner, which is not easy to do. How did your clinical and lab background lead you into this billing and practice management?
So I think I've always been made to do something on the business side. I like and gravitate towards a good Excel spreadsheet. So not everybody loves that. I'm a pathologist by background, but really have been doing some level of consulting or business since residency. Was kind of thrust into some consulting arrangements early on, enjoyed it. My parents ran businesses, and so I think I've got into that really early on. I've spent my career somewhat on accident in business. I mean, I was thrust into the administrative world really within, days after finishing fellowship and just loved it. That's just where I enjoy. I like operations. I like process. And it's been fun. I mean, I think it's important in healthcare, especially nowadays, for physicians to have a really engaged way of managing healthcare operations, because we can think about it from the clinical sense, we can think about it from the patient sense, but then if we understand the financial piece, we can mishmash all of those so that it makes sense to make good operational decisions with the patient care in mind.
Yeah, which is amazing. And that's really interesting because you must have been very curious, because when you are, I don't know, a pathologist, you're in a lab, right? You're almost like a data investigator, right?
Yes.
And you really research all that. So it's interesting that you also have that side of you that said, hey, listen, I love the business side of it too. I want to understand that. So when you started this business, you started with your husband. So what was the initial inspiration? I'm very curious how that started. Was that his idea, your idea? How did that come together?
You're going to laugh. So honestly, it wasn't like, oh, we're going to go open a medical billing company. It was, he honestly was burned out with his job. He needed a change. We started thinking through, okay, what problem can we solve, right? Like most entrepreneurs, what is the problem I am capable of solving for others? And we were thinking about initially franchising. We were talking to this guy who had a waterless car wash. Going down a rabbit hole. and so then we pulled ourselves back out and go, okay, what do we really know and like and enjoy? And hearing a lot of my physician colleagues, they were struggling with revenue. It was post-COVID, just trying to wrap their heads around how do I, stay independent. And again, I've had 10 years of experience at that time, running, labs, but the problem is still the same. You have to have money in, money out. And so, we, built our company, got our first client, hired our first person who does, the billing and the coding and so forth. And then now we have, close to 70 people that work, under the team. And so, again, I think it was just one foot in front of the other. A lot of times I felt like I was flying by the seat of my pants, but it worked out. We have a really great team, and it's been very challenging, but also really fun.
Yeah, that's amazing, actually. And I'm thinking, even as a pathologist or you're working in a lab, you must have seen there was probably gaps in the market, right? And so even during that time, was that ever running through your mind, even like, hey, I see a potential opportunity here that maybe it took a little longer to actually pursue?
Yeah. I mean, from a pathology perspective, like we're all typically very detail oriented, very process oriented. And you could see just that, from an education perspective as well, we're not taught as physicians clear ways in order to run businesses and understand financial metrics in medical school. And that piece with my training, and plus, I just think my parents being in that space are things I really enjoyed. And so I think pathology was interesting because it had an opportunity to be on the administrative side from a young perspective. And then taking those skill sets into the billing company, we recognized that if we taught more information to our practices about the financial metrics, about KPIs, about what it means to have a good process around billing, that both we would be successful as well as they would be more successful. And I think it just kind of has evolved over that topic. And so really understanding operations is really important from a billing perspective. And I think that's where you see billing companies struggle 1 to 2 years after they've been brought into a practice, is because if you don't fix the operations, the practice is going to struggle. You're going to struggle.
Yeah, yeah, of course. And you mentioned your parents. That was interesting. If you don't mind us asking, what were your parents doing within the field?
Yeah. So my mom was a nurse, but she ran hospitals for many years, hospitals and surgery centers. And then my stepdad, who raised me, was an OBGYN who ran his own private practice. And so I think I was just soaking up all of those business things over the years of growing up. And so I knew fairly early on, like the business stuff is what excited me. I like to build, I like to create. And so just applying that in each phase of my career has kind of been the plan.
Yeah, and honestly, I mean, most of us, we don't really think about it as
No.
patients, right? We don't think about what does that look like on the back end in terms of the billing and all of this stuff. And so again, I find it really interesting because in my mind as a business person, I'm thinking maybe a certain percentage of them outsource this, right, to
Mhm.
billing companies. Maybe
Mhm.
some of them handle it themselves. I'd love to know what that looks like before talking about kind of juggling the
Yeah.
career and building a business. What does that look like in terms of buckets? What would you guess are the percentages of people who have their own practices who handle it themselves versus actually outsourcing that?
I mean, for us, I will say from our experience, I would say it's been a mix. It's been a 50-50 mix. Like we see
Mm,
practices big and small who've done it in-house and then are ready to outsource. And we've seen practices that have been outsourcing for years who've been frustrated say, oh, I'm just going to bring it in-house. There's a lot of pros and cons. And again, it, somebody asked me the other day, well, it must be because they're small. I actually disagree with that. I think that you can outsource when you're big and you can outsource when you're small, and vice versa. It just depends on the talent you have hired, who you have overseeing these practices, and what makes sense financially. But I would say it's a mix. I don't know industry standards, but from my experience, it's been about a 50-50.
yeah, that's interesting. And I think the hardest part whenever you start a new business is actually doing it, right? Because it's
Mhm.
really hard to leave a job you're already in, no matter what comfortable position in your life, whether you're good financially, emotionally. It's hard because you have to juggle a lot of things. And there's a lot of stress when you go out on your own. So I want to talk a little bit with you and I want to ask some questions about kind of juggling the career, building a business, what the work-life balance looks like, physician entrepreneurs, et cetera. So for doctors who are watching this and thinking, you know what, I'd like to build my own practice as you've done and very successfully, what's that first step that they should take to kind of set themselves up for success? Obviously, there are many, but maybe talk to that, what that looks like.
So I think everybody loves that work-life balance. It's like the buzzword of the last 20 years. I
Yeah,
think first and foremost, you just need to wipe that out of your brain because that's not reality. I think there are
exactly.
priorities. So may have more family priorities today than you do tomorrow, or you may have more sleep priorities on a Saturday than you do on a Tuesday. But I think that we get very wrapped up into this work-life balance. I would say for me personally, and then I'll kind of get to your other question. For me personally, the beginning of balancing a career, 2 kids, 4 dogs, all the things was very challenging.
Yeah.
There was a lot of work after hours. I still had my W-2 and I enjoyed that, career and job, but was determined to build something on our own. So, it was a lot of after hours, weekends time, and that's just what it took. Now the company has a whole administrative team. It's in a very different spot than it was 4 years ago. To your question about if you're listening and you're wanting to start your own, whether it's your own practice or your own business, again, I think it comes down to what is a problem you're trying to solve, right? And so if that's I'm going to build my own practice and see my own patients, a lot of times you're having to juggle, okay, how do I have an employed job and build a practice at the same time? We see a lot of practices who are trying to build their own practice and they go do locums instead of be employed so that they can build that on the side. So there's lots of creativity that you can do while still bringing in a paycheck. I think that helps decrease some of the anxiety. Obviously, you can just jump. I mean, financially, if you're able to do it, you have savings, loans, whatever, like just jump and go. I do think there's a level of preparation you need with building wait lists and really understanding a business case. I think physicians in general don't have a great grasp, and myself included at an earlier stage, around how to build a business case to understand the financial piece it takes to build a company, whether it's a practice or otherwise. And I think if you don't know it, you got to find somebody who does, because that is key to success.
Exactly. I mean, 100%. Even people that go to business schools, we know a lot of my friends have MBAs and they struggle in business, and you're transitioning from being a physician to running your own business. And you mentioned it. I think when I think about the mindset shift that has to happen, right, for physicians when you transition from practicing medicine, which already I think doctors are crazy busy anyway.
Totally.
And then you're adding becoming a business owner on top of that. I think the first thing is exactly what you said. You have to get that totally out of your mind that this is a work-life balance, because that is going to be very tricky. But what other mindset shifts kind of go through probably people's minds when looking to do something like this besides that one?
I mean, in general, physicians are life learners. I would categorize myself as that. I love to learn new skills and new things. And so you just have to understand, okay, how do I understand the gaps that I have personally? How do I find the people or the mentors or the programs that can help me teach me, those gaps? And then learning to know that, you're going to make mistakes and it's going to be fine. It's going to happen and you're going to figure out a solution, but you just got to fail fast and move on to the next thing. I also think there are some personalities, and I hate to say this, but there are some personalities who are meant to be employed, and there are some personalities who thrive in building a business. And you may not know if what side of the coin you're on, but you will figure it out quickly. And I think it's okay to go, you know what, I'm just better as an employee, and I'm better having an employed practice. And it's okay to say, I've been employed and now I'm ready to go start my own. But you need to be prepared that it is a lot of work. It's very much worth it, I think. For the private practices I see, they are crushing it, doing great. But it's not always easy.
Yeah, no, 100%. But what I do like about what you said is that I think it's for people who are curious, right? I always tell this to my wife. I'm a very curious person. So I will take maybe certain challenges that other people won't, because I think a lot of doctors are lifelong learners. Even though I'm not a doctor, I am very curious. I always want to learn and grow, right? And optimize. And so I would, want people to at least try it, and you'll know if it's for you or not. So I think those are all great points. All right. So let's dive in a little bit to kind of NatRevMD, the advantage for me, because as I did a bit of research, I do think there are some advantages, and you guys do an amazing job talking about revenue growth, increasing practice revenue, revenue cycle management, this sort of stuff. A lot of physicians are not trained in business and billing, as we talked about. They don't all have MBAs. They are physicians. And so that's a huge challenge. So how is NatRevMD different from, say, if someone uses standard billing?
For me, what we have built our company around is the education of the team members in the office. Where I see practices struggle is they bring on a billing company, and that's fine. And the billing company may be good. But if there is division in labor and who's doing certain tasks, you got the billing company on one side and the practice on the other side. If there's not direct communication between those two practices to resolve issues, and it's not so much, well, that's, on their plate to fix. It is a team effort, is a marriage. And so we've really tried to build our company around education, around operational workflows, around solving the problems in the office that impact billing. Because to me, that's the only way that in 2 years, you're still going to be with us and your finances are still going to be looking good. It's very easy for a billing company to come in and say, okay, I'm going to do all this stuff and I'm going to do a great job. And then it's amazing to me how many practices are 2 years down the line going, oh, well, now my AR is not as good. Got to fix the root causes of issues in order to be successful. And I think that a billing company needs to have that higher level support from people with decades of experience who really know how to fix those issues. And it's a constant challenge. New issues crop up every day.
Yeah, 100%. Again, I think in doing what you guys do, when you go through a company like NatRevMD in your business, you have so many repetitions of this. You have so many use cases. You have your operations really dialed in. I'm just thinking from a business perspective.
Mm-hmm.
And so that can help so much, and even when I was reading through some of your prospectus and kind of going over your core thesis, I see that you guys have helped practices increase revenue by 25, 30%, whatever that quantified amount looks like, it's a good amount. So can you share, let's say, a specific example or some of these things that kind of make the biggest difference besides simply maybe optimizations and stuff like that?
This is going to sound simple, but a lot of issues stem from two areas. Not actually looking in the software and realizing that you have rejections and denials that need to be managed. There's a lot of companies that will just call insurance companies and they do what's called a status of a claim, meaning they're just getting the same information over and over again, but they're not changing how they're submitting a claim to make an outcome different. Meaning, if we do the same things in business over and over again and expect a different result, guess what? You're going to be disappointed. So you've really got to figure out, okay, what's the problem I'm trying to solve? Okay, what do I need to change? And then doing that. The second thing is really around most practices struggle with what's called eligibility. So understanding that the patient's insurance is active, that it's current, and that it's approved for this practice is the number one issue we see in 100% of our practices. I can say hands down, it is the number one issue across all of our practices. And that piece has to be a team effort to fix and educate. And front office staff, it turns over. And so when you have turnover, that's going to result in people who need to be trained again. And that may, end up having, issues with denied claims. And so you have to be able to see those issues, fix them at the root of who's actually, talking to those patients, and then close that loop in order to improve revenue. And so honestly, it's not rocket science, but it takes diligence, communication, and a commitment from both sides.
Yeah, and I find that really interesting because I have another friend who also works in a business where, as a consultant, where all he does is go into businesses and basically optimize and fix what they're already doing because their operations aren't really set forth with great processes, right, in place to really maximize what they're doing. And I'm hearing you talking, and it's so interesting because I really am one of those people. I go into my doctor every time. I have my insurance card out. I have everything ready. I've already called my insurance. I've even gotten the code thinking maybe if I have that ahead of time. My wife's like, what are you doing? No one does that. I'm like, yeah, but I want to know because what if they bill it wrong and they try to charge me? So obviously I'm someone who's a little anal and I want to know the information. But I speak to a lot of my friends and I sit in doctor's offices and I see and I look around and I feel like 90% of the people there have no idea about their billing, about their insurance. They just go in and they don't know what's going on. So
Correct.
I really like what you're saying there because again, as we talked about earlier, I think patients, we have to bear some responsibility for understanding what's going on, right?
Yeah, 100%. And nowadays with all of the different insurance out there, right? So do you go to the marketplace? Do you get it from your employer? Are you one of the government payers? You have to understand all of that because there's different insurance carriers, there's different payment, payer plans, and it gets very, very difficult to have every physician know about every single one of those. And so if you, from a patient perspective, can be the person who says, I'm going to own my own information, you are going to get, more accurate bills. Your physicians, your practices are going to get better payment upfront. It just makes everything cleaner. I would say maybe that's 99% of people don't do that. So
Exactly.
Not 90, but it's a great idea to do that because then it just makes it easier for everybody. And I will say it is just the number one issue, or people having two insurances and
Yep.
they don't know which one is first at bat. And so then the office doesn't know it. And then that can cause all kinds of headache. And so really just understanding your insurance is really important. I know it's not easy. And so, hopefully there's somebody in the office or somebody that the office can have you speak to if there are questions. It is confusing. It's a pain.
It is. We don't make it easy. Again, some of my friends are from Canada, they're from Sweden, from Norway, and they just look at me and they laugh. They're like, are you kidding me when I tell them our crazy horror stories? I mean, literally, I think I was a couple of weeks ago, I was just trying to check a prescription for my wife. And I want to do like a little due diligence. And I want to look around and check 2 or 3 different pharmacies that are maybe not big box pharmacies and see if there's a price difference. And so I would call them one by one. I know exactly what the drug is that I'm trying to get. I have my insurance. They're like, we can't give you that information. You have to call your medical company first and then or call the doctor, have them send it to us. And then I'm like, but wait, I just want a price quote. So I have to send it to every one of you guys. And it's so hard because a lot of doctors are busy and the people in the office, and then I have to send it to 3 different places. I mean, is that what it looks like for a lot of people? Because it is crazy.
It is crazy. Most people don't. They just show up to the pharmacy and they pay with whatever,
True.
they get. But if you have complex, certain medications that are really, really expensive, like that doesn't work. I know a lot of clinical pharmacists who actually have started a business doing that sort of pharmacy advocacy, I guess is the word I'd use, where they take on that for the patients, especially, if they're older and they have multiple medications and they have all of that. And so, it's unfortunate that our healthcare system's coming to that from a, service that, requires cash pay and all of this stuff in order to navigate the healthcare system. But I do think it's where we're at. It's funny that you say Canada and Australia. So I did a podcast a couple weeks ago with an individual she's a doc who practiced in Canada. She's practiced in the United States and Australia. And she confirmed with me that every place has its own challenge, that while the US is the most complex when it comes to billing for, insurance, she reassured me that everybody has their issues. So it made me feel a little bit better. Not great about the billing situation, still hard as can be, but it's just hard. Healthcare is just hard. Managing population healthcare is not easy.
It is. And you're right, because again, I lived outside the US for 20 years and I used healthcare internationally for a long time. And while we have our problems, there are also a lot of amazing things that we do within our healthcare system. And so I think it's always good to point that out. Everywhere is different. And I also like to say that it depends on the person. Even your situation might be different, me versus you or someone else. So what about for new practice owners? So, I'm looking at this as a business, and I want to take on a little bit of this, but I really don't want to do it. I want to outsource it. But for new practice owners, what's that kind of number one early decision that you can make, or, make or break revenue that if you're really not focused on?
I would say the number one risk is not hiring the right people in your office for what you need. I know a lot of physicians who are just starting out, they want to keep costs low, which I completely understand. And I think there's ways to do kind of the micro practice where you have limited staff. You've got to figure out what your skill set is and what holes you can, fill versus where you need to hire. Because I feel like there's a lot of single docs who say, well, I can't afford XYZ roles, but then they, aren't capable themselves of either from a time perspective or a skill set perspective, being the office manager, training front desk staff, training the MAs, setting up processes. That may not be their, bread and butter. They're really good at patient care. And so I recommend that if that's not your skill set, if you're not process oriented, to identify a consultant who can help you part-time and just help set it up and then exit. And then in terms of billing, I think it depends. I think if you're very, very small and you can either outsource or get a 1099, most of the time it doesn't make sense to have an employee unless it's a combo role who's doing your billing and say maybe your office manager stuff. And then when they get too big, then, consider outsourcing. Just depends on, again, it comes down to what are you willing to oversee and be responsible for versus what are you willing to have somebody else be responsible for. And only you, the physician who's running that practice, is going to know, okay, I'm good at these things. I really suck at these things. And so I'm going to outsource.
Exactly. What are you really good at? How much do you want to take on? That sort of thing. And churn is a real thing. Look, people
Yes.
have to remember personnel is massive, whether it's restaurants who have huge churn or businesses like what you're talking about. And we're talking about today that retraining people, all of this is so much work. There's a cost to it. And so getting the right people, if not the first time, at least in the first 2 or 3 times versus continually having that churn can be a massive expense, right?
Yeah, very. Culture is a
Yeah,
hard thing. Hiring's hard.
it
It's not
is.
easy. I mean,
It's
once you
not.
get it down for your own company and the stage you're in, I think then you have a moment of like, okay, I've got this. Then you grow a little bit and then you go, oh, I need that next level. And then you struggle a little bit and then you settle. I mean, and that's just business. It's just kind of highs, lows, and but
Yeah.
hopefully at the same time you're continuing to grow each way.
Yeah, that is business, exactly. And I think every year you kind of fine tune it a little bit, but it's not always here. It's not always here. It's not linear, right? We know it goes
Mm-mm.
up and down. So that leads me to my next kind of question and wanting to talk about, because one of the things that I see is I think all of us think that every doctor is rich, right?
Mm.
All my friends are like, oh, the doctors have tons of money. And I'm like, do you know how expensive it is to run your own practice? And I go into all these things because I do have other friends who have their own practices. And I want doctors to get paid what they deserve. I want it to be easy for them, because for me, the more that friction is removed, the more time they can spend with me, the patient,
Mhm.
right? And really help me out in what we're doing. And companies like yours, I love this, because when I think about insurance billing, revenue cycle management, even regular business terms,
Mhm.
medical billing services and tips, insurance billing tips, all this stuff, what are your tips for succeeding on the insurance billing side so physicians can get paid what they actually deserve? Because that's such a big thing, right?
Oh gosh, metrics. You got to have metrics. You got to look at them. It's shocking to me how many practices will have the metrics, but they don't understand them or don't look at them on a monthly basis. And I really, really encourage, if you don't have, metrics that you follow today, sit down with your billing team, create those together, understand what they mean. Pick three. You don't need to pick 12 in the beginning. Just pick three. Identify those three metrics you're going to track and trend every single month. Sit down, review them, discuss them, go over them, understand them, figure out if they're not where they should be, why, and what you need to do to get there. So that would be the first thing. The second would be, and I know we kind of talked about it before, eligibility. Every single practice has this issue. If you don't have this issue, you're not looking. It's just a matter of understanding how big is this issue, and then who do I need to retrain in order to fix this. And then last is really just sitting down with your team and huddling on where you desire to have improvements. And that could be patient volume, that could be billing metrics, that could be financial profitability, and really kind of setting, okay, this quarter I'm going to focus on one thing and I'm going to work really hard to fix that. I'm going to measure something and then we're going to reevaluate. And then once you get to steady state, pick something new. I think it's very easy to get stagnant because patients are being seen and it is hard to balance. But somebody from a business perspective needs to be kind of having all and working on all three of those things.
Yeah, no, 100%. I mean, first thing, look at your metrics, like you said, know your numbers, right? Understand your business, make a plan. And for me, communicate with your team. Some sort of huddling, as you mentioned, is really, really good. But it's incredible how many businesses don't do this, even outside of the business you're talking about, which is really interesting. So
Mhm.
if I said, what's one overlooked insurance billing strategy that would, if not dramatically, let's say really improve revenue, and you want to give a quick hack there, what would that be?
I don't want to beat a dead horse, so I'm going to try and pick something other than eligibility. But if the listeners haven't heard eligibility, but I'll pick a different one. So I think just in general, understanding denials and rejections. We took over a practice, I guess it was about a year ago. We walked into the practice; they had 700 rejections sitting in their
What?
claims center. 700, and they had an in-house team and a manager, and all the things right on in-house, and the physicians kind of trusted the manager, understandable, but they weren't understanding the metrics, they weren't looking at the metrics. And again, this is not the physician's fault, it is reality of medical training, it is a reality of being busy with patient care. So when we walked in, those 700 rejections, many of which we were actually, it was still within timely filing, so we were able to fix and take care of. But really understanding, okay, what are my rejections, what are my denials, And you see that by looking at your accounts receivable and the age of that accounts receivable. So that's the amount of money that's owed to you, and understanding how much of that is over 90 days versus in total. And that can help you track and trend. Are there big issues in the practice that I need to deal with? And if those numbers are creeping up every single month, we've got a problem. And so we take over a lot of practices with old accounts receivable, and it can take 6 to 8 months for us to take care of that, depending on the
Wow.
reasons why. So I mean, we've had millions of dollars of old accounts receivable that we take on, and it's a beast.
Yeah, it is. And again, a lot of it is for me kind of business 101. It's, but I get it because physicians, doctors, everyone is busy. And so it's easy to overlook these small steps, right? Which you handle. And I think that's fantastic. So let's talk a little bit about specialty insights, right? Compliance, OBGYN billing best practices, what I read with MIPS, MIPS compliance tips, these sorts of things, because I find this part really interesting. So in your OBGYN billing webinar, which you had earlier this year, I believe, you
Mm-hmm.
shared 4 or 5 different best practices, let's call them. So can you walk us through at least maybe 1 or 2 that maybe every specialist could kind of learn from who's watching?
So I'm going to talk OBGYN specific for a second. We have a lot of really big OBGYN practices, and OBGYN is in my opinion, and we have maybe, I don't know, 8 to 10 subspecialties we bill for. To me, the hardest one. Now, my OBGYN certified coders, they love OB. Maria on our team, she like literally lives and breathes for OB. But OB, and it's just hard for me. But OB is really tricky because you are seeing a patient over 9 months. And guess what changes often over a 9-month period? Your insurance. And
Yeah.
so you have to really understand the guidelines around when insurances change and how you bill out a global or a pregnancy when it comes to changing insurance. And so really, really need to be careful of those sorts of things. I would say in general for multiple subspecialties, it's very common to have coding denials or not really understanding what is bundled within one CPT to get payment. And so you may bill 4 CPTs, but 2 of them may be bundled together to get paid one fee. And so if practices don't understand this, they may not understand either how to document something, how to use modifiers, or how to take visits and put them on 2 different days so that you get paid for both of them. And so
Hmm.
really understanding your coding and your practice guidelines, like I said, whether that's OB and how you bill out, how you code certain number of visits by your insurance, or how you code a procedure based on telling the story of why you did certain things so that you get paid the maximum amount. And the good news around this, though, for the listeners is most physicians use 10 to 20 codes, but you need to learn them. You need to know them. You need to understand the rules, you need to understand when they change. And if you don't, have a coding audit, meet with a coder and learn them.
10 to 20 codes. Oh my goodness. That's amazing. That's really interesting. I did
Yeah.
not know it was that many. Wow.
Oh, well, and some practices, may use more than that if they're more general, but most use, I would say, less than 20 in total. But they're not terrible to learn those, but you need to learn them.
Yeah. Let me ask you this. Before we talk about MIPS and MIPS compliance, I find this really interesting listening to what you're talking about.
Mhm.
It seems to me that there's so much friction in the codes and all of this stuff. It seems so complicated. Is it too difficult at this point because the beast is so big to tame it and reduce these codes to make it easier?
I don't know how we got here as a United States society. I mean, I think to some
Right?
part, it's like this cycle of new codes come out, then they're maybe overused because everybody's maybe feeling like they're underpaid elsewhere. So then you use them more, and then the insurance company catch on to that. So they're like, well, I'm going to make it more complicated. And then it's the beast that just keeps on growing. Again, that's my personal opinion. I just think it's you'd almost have to just start over
Yeah.
in order to get this to be easier. And I don't know if anybody, I don't know, that would be nice. But
Yeah.
for now, I think it's just the complexities are complex. And so you either need to learn them or you need to hire somebody you trust to teach you them and really at least have a high level understanding.
Yeah. And again, there are people like yourself and others, which I love, that can handle a lot of that for you if I'm a physician and let me focus on doing what I want to do, healing people, et cetera. So, okay, let's talk about MIPS compliance. What is that, first of all?
Oh, MIPS. So CMS decided to come out with, and so I don't want to harp on CMS. Like, I think that the mission behind what they were trying to do, they were trying to set up value-based healthcare, right? So they were trying to put in quality metrics that in general, patients need to have certain things in order to continue to have a good quality, healthcare journey, right? So certain labs, if you're diabetic, certain tests at certain intervals throughout your life, if you're over a certain age. Great intention, but now we've stuck with all of these rules we have to comply with and all of this data we have to submit. And I'm just talking Medicare right now. And so for a practice that's itty bitty, there you can actually go onto Medicare, put your MPI number in, and understand if you qualify. If you are a larger practice, you likely qualify that you need to submit certain metrics. You can pick your metrics to some degree, submit them on a yearly basis, and then that determines whether or not you get extra money or a little less money. And so it's really important for practices to understand, do I qualify? What metrics do I need to submit and on what interval? And who can help me do that? We don't necessarily kind of involve ourselves in the submission process. We're happy to consult on that sort of thing. But most practice management software, so the EMR, the software you choose to do billing out of, will actually have modules to help you do that easily. You just need to work with the vendor in order to understand, what am I choosing, what interval, approve the submissions, and then train your docs to make sure that they know the flags they got to check to say, yep, I got that, your analysis. Yep, I did that blood glucose. Yep, someone got their colonoscopy this year, so it's just, again, it is the name of the game right now, and it can result in, several percent lower reimbursement if you don't do them.
Yeah. And obviously you don't want that as a business, which is important. And maybe there are some tools coming our way that might help with this. So this is my transition into all things technology, future trends, right? AI medical billing, cash pay models, which I interviewed a doctor a couple of weeks ago about a cash pay model, hybrid practices. Mm-hmm. So I assume AI is entering the billing space at some point if it hasn't already. So what role do you see it playing in that coding accuracy? Because I would hope that hopefully it will be able to help with coding accuracy, right? Claim submission and denial prevention, that sort of thing.
So I'll talk in a couple different buckets. So for me personally, we are using AI in our company every single day. I love it. I think it's important to augment, things. Like, I have some managers who don't love writing concise emails. So I have them write a draft, throw it in ChatGPT or whatever your choice of AI engine, and let it spit out something better. Then we've got full RCM services. And I think, so I've interviewed a few companies to try and streamline a few processes. They're not quite there yet. I think it will get there to solve certain bottlenecks, but it's not going to completely, replace all of what RCM companies do. And then last, there are softwares already on the market that integrate with your PM software to help transcribe, to help code, to help suggest things. Some of them have had some fancy lawsuits in the last couple of years who they were overcoding or undercoding. So again, you still have to have the knowledge. It can help from an efficiency standpoint, but the accuracy of all of these things, I think, is an evolution. But I'm excited about AI personally. I think it's fun. It's fun having my 12-year-old kind of get used to it, and because it's going to be their world more than ours.
100%. So how will changes, let's say in insurance models like the cash pay system we mentioned, or maybe a hybrid practice, how will that impact billing near term? It's hard to guess, 3, 4, 5, 10 years down the line, but let's even say the next year or two. How do you see that changing, other than just maybe, making more concise emails and stuff? You mentioned a couple of items there as well, but what are your thoughts?
I think it's going to help with coding. I think that's probably the easiest thing to help with. Our coders are already kind of using it to summarize or compare certain things, but they have the knowledge to be able to do that. We've had some practices send us questions. You can tell the responses are coming straight from AI and they're not accurate. And so you do have to really be careful that you understand the information in order to determine if it's right or wrong. And then last, what I'm really excited about is actually using AI agents to make insurance phone calls, to call the insurance companies, sit on hold, wait for them, be able to ask simple questions from a script, and then have a human that falls back. I haven't found a company that I really enjoy for this, so I'm thinking about building our own. We actually have a meeting on Friday to talk about it, so it's good timing.
Amazing. It's great that you're at that innovative forefront because I will pay a lot of money for that. And I think everybody will. We're so tired of sitting on the phones, as I'm sure you have done in your life as well, and waiting, whether I'm talking to my healthcare provider, a doctor, whatever. And, I have a couple of friends also in that space where they're building out, the AI agents, which eventually I think a lot of us will have our own. And that could be a huge factor in kind of diminishing a lot of that wait time. So everybody can be busy doing other things that are maybe more impactful, that add more value, right?
Exactly. I mean, I think it's just we're trying to cut out the non-value add waste. That is the key here. We're still going to need those individuals as fallback. We're going to still need those individuals to make decisions and help solve problems. But I'd rather them solving a problem than waiting online with United Healthcare.
100%. 100%. What about individual, let's say advice for physicians, right? Physician entrepreneurship tips, building medical practices, work-life balance, as we talked about earlier. But for doctors building a business while still practicing medicine, and that would seem like a tricky space for me. What's your best piece of advice there?
I think the biggest thing is really understanding, where do you want to go? And I think that a lot of activities you can just spin and you can do a whole bunch of work, but it's not getting you to the end goal. Like if you want to build a practice that's multi seven figures, your activities are going to be very different than I just want a micro practice that's going to allow me to cover my financial expenses and have only work 3 days a week, or be able to have afternoons off so I can go pick up my kids from school. And I think as physicians, we get into this rat race of, okay, I'm just going to go full steam ahead, but not really sitting down and understanding what you want personally. And so I think having that clear understanding of, okay, this is what I need financially, this is what I want my work-life balance to look like, or my work week to look like. What does that look like today? What does that look like in 10 years? And then setting priorities from there. And if it's the 7-figure multi-specialty massive, group, that's going to look very different than somebody who is a solo practitioner, wants to have 2.5 days at work and have a micro practice. And so again, really taking the time to sit down and do that on an annual basis. I mean, I'm not a coach, but I'm a big fan of, sitting down with somebody to help you walk through that. Because it changes, because you don't want to wake up in 10 years and go, I've just worked my butt off doing XYZ, but it's not what I enjoy.
Yeah. And that's a big part of it. I mean, it's not always going to be, sunny days every day, right?
Mm-hmm.
But 80-20 rule, let's hope at least you can get greater percentages of your time enjoying and doing what you're doing, because again, that's the whole point of all of this. So if you could give every physician entrepreneur who again is listening and thinking about this, that one kind of golden rule, we talked about metrics, we talked about hiring, et cetera, but for building a thriving, financially healthy practice, in addition to what we've already talked about, anything else we're missing?
Metrics from day one. I mean, I know we've already talked about that, but that's got to be on there. Really understanding and sitting down with yourself and to go, okay, am I a process person? Because if you're not a process person, you need to identify somebody. And it's okay if you're not a process person, but you've got to really understand. And what I mean by that is if you can say, okay, I need my front office staff to understand eligibility and know how to do eligibility in the front office. If you and yourself can't step out, okay, step 1 is going to be this, step 2 is going to be this, step 3 is going to be this, and that needs to happen on these days of the week. If that's not how your brain thinks, you need to find somebody, because that's where I see practices struggle, is they fly by the seat of their pants. They kind of just are like, yeah, you got to go do some eligibility. I don't know, figure it out. People struggle with being able to implement actions based on not having a process, a policy and procedure. I'm a pathologist. I love a good policy and procedure. So you just got to have
Sounds like a great business, any great business person I know. I love policies and procedures. I love SOPs.
You got to love it. So, but if that's not you, if you're like, oh God, that's terrible, I don't want that. Fine. Don't be that person, but hire that person, consult them.
That's right.
1099, part-time office manager, whatever you got to do, but please don't open and run a practice or business for that matter without somebody who knows and loves the process.
Find a way to deal with it. Don't ignore it, right?
Correct. Find a way.
And that's such a big part of all of this stuff in terms of the business. And it's so interesting because when I look at it and I think to myself, okay, here's someone like yourself with NatRevMD, and you guys are innovative and you're taking the next steps. But I'm curious, what do you think it'll look like? And again, we're not guessing 10 years down the road, but in 4 or 5 years, you must have ideas like, oh my gosh, we can do this and this with AI. We can make it so much better. We can make it frictionless. What does that ideal process look like for you in 4 to 5 years once AI really kicks in and you get it to where you really want it?
I think we've built the AI agents by then. I think we're able to be more efficient and have our denial rates and our response time to claims even lower. And I think we're able to lower our rates because it's less expensive for us to do things because we don't need as many people. And again, we'll still use people in different capacities, but just elsewhere. That's what I think. That's at least what I can see for the next 3 years. And then, continue to educate and continue to build out and improve our dashboards that we provide to practices. I think there's some really cool tools on the market that are able to take complex data and put them into a very visualizing, pretty format to help people. Now, we can do a lot of that with a huge, massive data team, but I think AI is coming to make that simpler.
Yeah, 100%. And even as I'm listening today and I'm thinking, we talked about increasing revenues 25 to 30%, and all that is amazing by working with NatRevMD and companies like yours. But what I'm hearing is just businesses have to have plans, right? They have to have a plan for this, whether they outsource it, whether they, have a consultant, whether they work with you guys, but they have to have a plan because if not, they're leaving a lot of money on the table, correct?
Correct. And if you're not looking, who is? And if you can't answer that question, or if you don't know for certain that somebody is looking at those things, time to have somebody at least come in and do an audit and understand what could be going differently.
Yeah, and that's a huge point. So all of this is great. Love having this information. I'm hoping that everyone watching right now will kind of learn a lot from this conversation. And now what I'd like to do is bring on what we call the clear signal. And that is that great medicine and great business aren't opposites. For me, what I'm learning is they're actually partners in this entire thing, as we've talked about today. So today, Dr. Signorelli showed us that when physicians take control of their revenue and the processes, so important, all those metrics, everything, they reclaim their time, freedom, and focus to do what matters most, which is caring for all of us, the patients. And that is never a bad thing. So again, because the heart of healthcare for me is always trust, like it is here at DocPod, between doctor and patient, and between medicine and the systems that sustain it, we have to focus on that. So again, your message is clear for me. Take charge of your business, protect your revenue. And again, you can protect your ability to heal others through doing that, which is such a great thing. So a special thank you to Dr. Heather Signorelli. I have to say that properly. I love that name, by the way, of NatRevMD. And those watching and listening, thank you for joining us on DocStars. And as always, please like and subscribe because again, without that, that's very crucial in allowing us to continue talking to these amazing doctors and healthcare leaders around the world. And also make sure to follow us on the DocPod channel because health, it's everything. Thank you.
Celebrating the world's best. This is DocPod's DocStars.